are malignancies? So when the skin cells develop DNA damage and are unable to repair, mutations can occur. The mutated cells can reproduce rapidly and turn into cancerous growths. Skin cancers can arise from either the epidermis or the dermis and can grow and extend through the layers of the skin into your deeper tissue. So we're going to talk about basal cell carcinoma, squamous cell carcinoma, melanoma, and Kaposi sarcoma. So I was an oncology nurse, so I did get to see some of these skin cancers. So we're going to just dig into those. All right, so what are some risk factors for skin cancer? If a patient has too much sun exposure, example, using tanning beds. If they have genetics, right? Melanoma can be more common in certain families. If they have light skin, blonde, red hair, green, or blue eyes, that's a risk factor. Exposure to toxic chemicals, and if they have a history of frequent sunburns as a child. So those are some risk factors. So a lot of this stuff, you're looking like, I really can't prevent any of this stuff. We're going to talk about prevention later on. But we know that we can prevent too much sun exposure, right? We can prevent being exposed to toxic chemicals if you have knowledge of them. All right, so the first one we're going to talk about is basal cell carcinoma. So this is the most common form of skin cancer. And the appearance of it, I have some pictures of it on the screen, but the appearance in words is it's pearly, it's glossy, it's shiny, it's waxy, and it's going to be a small raised bump with a depressed center and slightly elevated border. This is a slow growing cancer, and the rate of it metastasizing is very rare. So this cancer doesn't really spread to other places. And it starts in our basal layer. So what are some common areas that you are going to see this? And it are areas that are exposed to sunlight. So your nose, your face, your hands, your scalp. So you want to just make sure that you know common locations. Make sure that you know the description of this cancer. All right, squamous cell sarcoma. So squamous cell carcinoma, this one is made up of your keratinizing cells. They are common in sun-exposed areas of the body. Compared to your basal cell sarcoma, squamous cell sarcoma are more serious and are likely to metastasize to your blood and your lymph nodes. Okay? So with squamous cells, we will see metastasis, and it happens in the same sun exposed areas, but the description of this one, they're going to be red, scaly, patchy areas, right? Crusty, hard covering, scaly type of description, like little skin things. So if you can see it on here, there is your squamous cell. Your borders are wide, more infiltrated, more inflammatory. But this one is way more serious because this one can spread. Basal cell sarcoma, I really haven't seen basal cell sarcoma, but squamous cell sarcoma, I have seen that one, and I have seen that one metastasize to other places. So definitely know that this one can metastasize to your blood or to your lymph nodes. And this one has that scaly, patchy, crusty looking covering on it, okay? So melanoma. Melanoma typically occurs in the skin. However, melanoma can also arise in other body parts such as the eye. You have thicker, deeper lesions tend to be more serious. Melanoma has a significant potential to metastasize, right? So this can spread elsewhere. It manifests as a change in your niveus or a new growth on the skin, right? So these are the patients that may have a little mole here, right? But then it starts to change. So anytime you have a patient who has like a mole or something, we always want them to watch it to see if it's changing and all that color. So the color of this one is going to be dark, red, blue colored, or a mix. The shape is going to be irregular. They may complain of itching, ulceration, bleeding, and all that stuff on there. So then parents, you want to use your ABCDE acronym to help detect. So symmetry. If the line is placed in the middle of the lesion, it would not look the same. So this symmetry and asymmetry, this is off. Their symmetry is wrong, right? They're going to have irregular borders. All right. It involves in shape and size. It is most deadly form of skin cancer and has a high risk of spreading to your brain, lungs, bones, and etc. if it's not detected earlier. All right, so you want to make sure that you know how to use your ABCD, and just make sure you go over your, this is a nice chart to show if it's benign or is malignant. So if it's not cancerous or non-cancerous, know this little chart right here just to compare the two, and also to even teach your patients how to use ABCDE, right? When looking at different skin changes in their body, because everything that shows up on our body is not cancer. So we want to be able to educate our patients on this. All right, so we just went over the types of sarcomas and stuff, skin cancers. So prevention, what can a patient do? So you want to make sure that you perform a thorough skin assessment and identify possible cancerous lesions, right? Follow the ABCDE assessment and teach your patient how to do this monthly, right? Prevention, you want to teach your patient to avoid direct skin exposure between 10 a.m. and 4 p.m. Why? Because sun rays are the strongest during those times, right? That is the hottest time of the day, right? You want to wear long sleeves. Why do you want to wear a long sleeve? To protect your skin. Sunglasses and a hat to avoid unnecessary sun exposure. You want to use sunscreen that is broad spectrum with the SPF of 15 or higher for exposed areas when outside. And you want to avoid tanning beds and toxic chemicals on the skin. So we want to do all that we can do to prevent a patient from getting skin cancer. So, in an event that we couldn't prevent it, there is treatment, surgical. They could have a surgical incision where they could actually get that little area removed, as you can like see on the picture here. Different types of surgery that they can have. They can have radiation. They can have topical chemotherapy, but the biggest thing that we want to focus on is prevention, and knowing that they can go a surgical route or other alternatives, radiation and stuff, to deal with cancer. We're going to have a I think our lecture maybe next week or so about taking care of a patient with cancer, and that's when we'll dig into some cancer specific things. But just knowing for skin cancer, just knowing for this chapter, what are the different types of skin cancers and what do they look like, and what's our prevention. So if you have any questions on this chapter, definitely bring them to class. Definitely reach out to me via email if you have any more questions.